Good morning, students. You know, cross-section anatomy is an important part of our practical examination. Today, I will show you the cross-section of abdomen and cross-section of thorax, and I will introduce some important structures of these two important regions. So, let us start with the structures at the section of the abdomen. This is the section of abdomen. Here, we can start from posterior to anterior side. In the posterior side, we can see a vertebral body. Behind the vertebral body, this is the foramen called vertebral foramen. Here we cannot see the spinal cord. At the termination of spinal cord, the cauda equina starts. So now here we can see the different filaments. That means it is at the level lower than the lower border of the spinal cord. At least it should be below the level of first lumbar vertebra. And behind this is the spine of the lumbar vertebra, and on each side of the spine we can see the back muscles. And if you see on both the sides of the lumbar vertebral body, we can see the two muscles, one on each side. These muscles are the psoas major muscle, and psoas major muscle, it is covered by a fossa called psoas fossa. This is psoas fossa. This psoas fossa, it is laterally continuous another fossa which is coming anteriorly to form the innermost wall of the anteabdominal wall called fossa transversalis. And the psoas fossa, it is extending upwards and is thickened to form the medial arcuate ligament, deep to which passes the least branching nerve and sympathetic trunk. Next, if you see on back sides, behind the psoas major muscle, here you can see another muscle. This muscle is the quadratus lumborum, and this quadratus lumborum, it is enclosed by two layers of fossa. Anteriorly it is called anterior layer of thoracolumbar fossa, and posteriorly it is called posterior layer of thoracolumbar fossa. Both the fossa fuse laterally, and the anterior layer of thoracolumbar fossa, it is extending upwards and it is thickened to form another ligament called lateral arcuate ligament, deep to which passes the subcostal vessels and subcostal nerve. So we got three arcuate ligament: lateral arcuate ligament, medial arcuate ligament, and median arcuate ligament. Lateral arcuate ligament, it is the upward continuation and thickened part of anterior layer of thoracolumbar fossa. Medial arcuate ligament, it is the upper thickened part of psoas fossa, and the median arcuate ligament, it is the ligament passing in front of the aorta between the right crus and left crus of the diaphragm. Then we can see the which one is right crus and which one is left crus. Can you see this is the vertebral body, and in front of, on the right side, this is the right crus, this small part. On the left side, here is the left crus. Left crus is smaller because it extends up to the second lumbar vertebra, and this right crus, it is extending downwards further up to the third lumbar vertebra. And so right crus is larger, left crus is smaller, and in between these two crus, the ligament is called the median arcuate ligament. Then in front, here is a thin wall structure, the thick wall structure. The thin wall structure on the right side is the inferior vena cava, and on left side it is thicker, and this is the abdominal aorta. We know in the posterior abdominal wall we got the vena cava on the right side and abdominal aorta on the left side. Here it maintains this relationship, and on both sides of the vertebral body and psoas major muscle and its fossa, we can see the cut section of the kidney of both sides. Right kidney is related to the 12th rib, and left kidney posteriorly it is related with the 11th and 12th rib, and on both sides we will get only 11th intercostal space. This cut section of the kidney shows the outer part is the cortex and inner part is the medulla, and all these are the pyramids. And here is the sinus of the kidney, and on both sides there we can see the hilum, and the hilum of the kidney, here you can see one artery also extending from the aorta to the kidney. That means it is a cut section of the left renal artery, but we cannot see the right renal artery because right kidney is at a lower level than the left kidney. Here we can see the two openings, one right side, one left side, and this opening, it is the opening for the cut section of the second part of the duodenum, and third part, it is deep to it if it is continuous with the third part, and here it is the fourth part. If I introduce this wire through the second part and it runs to the third part and it comes out through this part. That means this is the second part, then third part, this is the wire in the third part and coming out from the third part to the fourth part of the duodenum. And this duodenum, this part again, it is continuous with the jejunum. So this is the jejunum, it is cut here forming the duodenojejunal flexure and which is at the level of the transpyrotic plane or lower border of the L1 vertebra. So this opening, this is for the proximal part of the jejunum. And here you can see this is the mesentery. The mesentery means the mesentery, it is attached with the jejunum and ileum, not with the duodenum. So here we cannot see the mesentery in the duodenum, but we can see the mesentery here with the vasa recta. We can see the vasa recta and the translucent window also in this mesentery. So this is the mesentery which is attached along the intestinal border because this is jejunum. And if you trace it, we can see the coils of intestine, that means jejunum and ileum both. All these are jejunum and ileum, and this mesentery, it is thicker towards the ileal side. Can you see? Here we cannot see the translucent window because of abundance of fat towards the ileal side. But on the jejunal side, we can see the translucent window and also vasa recta. So whole thing is the intestinal border of the mesentery. And the other border of the mesentery is a fixed border or vertebral border which is extending obliquely from the left side to the right side. On the left side, it is at the level of second lumbar vertebra from the duodenojejunal flexure up to the right side, up to the iliocecal orifice, that means to the right sacroiliac joint. That length of this root is about 15 centimeter, but the length of the intestinal border towards the intestine, it is about 20 feet or 6 meter. So the small gut is free to float inside the abdomen because of the mesentery. And on both sides we can see to other opening. On the right side, this opening, it is the opening for the colon, ascending colon, and the left side is the descending colon. We know the colon is identified with the three important features. One is the tinea coli, second one is sacculation, and third one is the appendices epiploica. We can see, if I retract this, we can see these small peritoneal pouches. These are called appendices epiploica. On both sides, we can see the appendices epiploica. But the appendices epiploica are not present in the cecum, then in the appendix, and also in the rectum of the large gut. Remaining part of the large gut, they are having this appendices epiploica. Where you will get the tinea, there you will get the sacculation. In front of this is the pancreas. This pancreas having four parts, all of you know, the head, neck, body and tail. But in front of the pancreas, there are two main openings are there. One is thinner toward the right side, one is thicker toward the left side. The thinner one and wider one is the superior mesenteric vein, which forms the portal vein. And here is the superior mesenteric artery, which is the ventral branch of the abdominal aorta. The relationship of these two important structures, the vein is right to the artery and they are passing in front of the uncinate process of the pancreas. So this part should be the uncinate process. This is the head of the pancreas and this is the body of the pancreas. And another opening is there in front of the superior mesenteric artery. Probably this is the jejunal branch or jejunal artery coming out from the as a branch from the superior mesenteric artery, because this is, you know, this is jejunum. This is jejunum. So this artery, it is entering through the two layers of the mesentery and passing to supply the jejunum by this vasa recta. So this is the jejunal artery. Then if I go forward anteriorly, we can see there are two muscles are there in the anteroabdominal wall, one on both sides, and these muscles are the rectus abdominis muscle. Rectus means straight, so this rectus abdominis muscle extending from the xiphoid process to the symphysis pubis below, and it is having so many intersections, and segmentally it is supplied by the lower intercostal nerves. And on behind another muscle is there. That muscle is the larger one. That muscle is the erector spinae muscle, This is the spine of the vertebra. On each side of the spine, you will get the erector spinae muscle. The name, it indicates that it erects the spine or it straightens the spine. So the name is erector spinae. And behind this erector spinae, there is another fascial layer that is called posterior layer of thoracolumbar fascia, which covers the erector spinae muscle from behind. So if we summarize this thoracolumbar fascia, there are three layers. One is anterior layer, anterior to the quadratus lumborum, then middle layer, it is between the quadratus lumborum and erector spinae, and posterior layer, it is behind the erector spinae. All the three layers going laterally and they are continuous laterally. And here also we can see some cut section of the ribs. This is the cut section of the rib on this side, the cut section of rib here, cut section of rib here. So that's all regarding the cross section of the abdomen.